If you have a sharp, burning, almost electric line of pain shooting from your lower back or buttock down the back of one leg, you might be dealing with sciatica. And here is the reassuring part. For most people it settles within about 4 to 6 weeks with simple self-care, and roughly 80 to 90% get better without surgery. In this video, I want to walk you through what sciatica really is, what it feels like, why it happens, how it differs from look-alike problems, what actually helps at home, and the warning signs that mean you should be seen right away. One thing before we start, this is Here is something that surprises a lot of people. Sciatica is a symptom, not a disease. The word simply describes pain traveling along the path of the sciatic nerve. That nerve is the largest in your body. It is formed by nerve roots that exit your lower spine, around the L4 through S3 levels, and they join together, then run through your buttock and down the back of your thigh and calf. When one of those nerve roots gets irritated or squeezed where it leaves the spine, you feel pain, tingling, or weakness along that whole route, and almost always on just one side. So who tends to get sciatica? It is most common between roughly ages 30 and 50, with a peak in the 30s, and over a lifetime somewhere between 10 and 40% of people experience it. The usual cause is a herniated or bulging disc in the lower back, especially under age 40. In older adults, narrowing of the spine, called spinal stenosis, becomes more common. Let me give you a quick self-check. Is the pain mostly on one side? Does it travel below the knee rather than staying in your back? Is it sharp, burning, or electric instead of a dull ache? Do you have numbness, tingling, or weakness in that leg? And does sitting, coughing, leg and buttock pain has more than one explanation, so let me help you tell true sciatica apart from a few common look-alikes. True sciatica is nerve root pain. It is sharp, burning, or electric. It runs down the back of one leg often past the knee. It frequently brings numbness or tingling, and it gets worse with sitting, coughing, or bending. Piriformis syndrome, where a deep buttock muscle irritates the nerve, tends to be more of a deep, aching buttock soreness. Simple muscular low back pain is usually dull and stiff and does not shoot far down the leg, and hip or referred pain is often felt in the groin or outer hip and gets worse with weight bearing. Now the good news about treatment. Most sciatica is managed at home in the early weeks, and the news on timing is reassuring. Most cases settle in about 4 to 6 weeks, and roughly 80 to 90% of people get better without surgery. So what helps? First, stay active. Prolonged bed rest is not helpful, and gentle movement and light walking are generally better. Heat or cold, whichever feels better to you, can ease discomfort. Over-the-counter anti-inflammatories like ibuprofen or naproxen may reduce pain, but they are not right for everyone. So check with a pharmacist or doctor first. And gentle stretches and physical therapy, building core and back strength and nerve mobility, are Before we finish, the part you must not skip. Most sciatica is not an emergency, but certain symptoms can signal a serious problem and need emergency care right away. Go to an emergency department if you have new loss of bladder or bowel control, numbness in the saddle area around your groin and inner thighs, progressive or both-sided leg weakness, fever along with back pain, or severe pain after a significant fall or injury. Also tell your doctor promptly about unexplained weight loss or a history of cancer with new back or leg pain. So to recap, sciatica is nerve pain down one leg. Most cases improve within 4 to 6 weeks. Staying active and